Welcome to another episode of Beyond Physical, where we talk about the mental, emotional, social, and at times spiritual benefits of exercise. We believe that exercise is more than movement, and this podcast is our attempt at sharing that message with the world by sharing our own as well as our guests' experiences and knowledge. If you enjoy it, we ask that you please spread the message by leaving a rating and review, or even better, by sharing with a friend. Welcome back to another episode of Beyond Physical. It's good to be back. Very, very excited to have Brandon Burke of Burke Biokinetics with us here today. Thank you so much for making the time, Brew. Gideon, I know, is absolutely frothing to get stuck into this
Very
episode.
excited.
I think it's the most excited I've seen him for an episode to date, and I think lots of kind of reason for that. We had a nice chat on Friday to just cover the surface of what some things we're going to touch on about today. So, yeah, Brandon, obviously you come from a very high-level sporting background yourself. You're a practitioner. You're a doer. You do the hard things. Very competent swimmer. Very competent water polo player. Took it to the pro tier level. Are you a pro tier if you've played SA water polo? It's a pro tier, correct? What is the?
To be honest,
what's the name of the thing?
I don't think it's a pro tier. I think it could just be a springbok, or
It's
I'm
a springbok.
I'm not sure. Yeah, I have to find that out.
Okay.
Yeah.
Because
I think, yeah, it sounds more natural to be a pro tier, but yeah.
because I don't know.
Yeah, it's something that I have to research, but
Because different sport codes have different.
I don't think polo even has a name, bro.
You guys need to sort that out.
Yeah, I think we need to get on that. Yeah.
But that's Brandon. Do you still play a little bit of water polo?
So I don't. I've retired from hung up the costume and the cap. Yeah, no, water polo is an amazing sport, incredible. But yeah, I kind of I've been focusing more on life things, you know, and I think it's a great sport, but it's not something that you can kind of do at 50%. So it's something that, you know, if you're going to do it, I would say push to do it at 100% and just be fully involved in that environment. But yeah, I think stepping away from it's just something that I think most guys do, just because there's not always a future. You know, you can't really see too much of a future in the sport in South Africa, unfortunately. That's obviously another episode in itself, but yeah.
The state of South African water polo.
Yeah.
And it's just
definitely.
time consuming as well. You can't
100%,
just
yeah.
like go on a random Thursday and like you have to be part of a squad
You
and
have
like
to, yeah.
so it takes up
It's
a lot
team
of time.
sport, you know.
Exactly.
It's if it was an individual sport, then it's different, yeah. But
Yes.
team sports, you've always got to be involved in the team, like you said. You've got to be there. You've got to create that sort of sense of community in the team and give your all. So I think where I'm at now, I'm kind of moving more into the biokinetics world and the rehabilitation within those team setups. So that's something that I'm really interested in, is offering rehabilitation to teams, especially in the niche of water polo. So hoping to get that sorted. Yeah. But yeah, I just want to say thanks for having me on the podcast.
Absolutely.
Incredible to be here. Super grateful. It's my first podcast, so
Really?
thanks. Yeah, it is.
Congrats, Brew. That's awesome.
Yeah, no, it's great to be here and such a
Debut.
great environment. Yeah, awesome, man.
Amazing. So you hung up the cap, you hung up the cozy,
Yeah,
and you got
tired.
stuck into helping people move and feel better. And you've really gotten down into the minutia of that, taking a deep dive.
Yeah.
Biokinetics, it's a really exciting field.
Yes.
And it's an interesting path because you obviously went the sports science route and then decided to specialize and go bio. So to get under the hood of what brought you here, you now have your own practice, you're setting the foundations for that. What motivated the kind of shift into bio, and how come you've decided to make that your life? What about bio is special, and why did you pick that path?
100%. Yeah, no, it's a great question. I think what's so great to be in this environment is obviously, you know, I think when you start your journey, it's a little bit of like you land up in this kind of area of coincidence and luck and a bit of passion and curiosity. I'm sure for you too as well. Kind of starting out your journey, it's a little bit of this curiosity, and I think that's why when I initially begun this kind of venture, I wasn't really fully aware that biokinetics was a thing. You know, I think when everyone starts out, they've kind of find their passion as you go along. For me, I knew I didn't want to do kind of a job that unfortunately, I didn't want to do a desk job, and I was like, I want to be on my feet all day. And another thing that I knew is like I wanted to connect with people, I wanted to work with people and change people's lives. Something that obviously influenced me was like through my dad being in the medical field and wanting to kind of follow that route. So I chose to do sports science, which was a great decision. Yeah, I think at the undergraduate level, there's obviously it's very broad. You know, there's not much niche in terms of biokinetics, and that's why they're actually moving to a 4-year biokinetics degree. So for those of you who are listening who want to start studying biokinetics, I think they're in the process of changing it to a 4-year degree, which is actually amazing because you kind of go from an undergraduate in sports science to this 1 year, which is so full on, and it's your honors year in biokinetics, and then they kind of have to cram all the content into 1 year. So it's one of those things where it's quite difficult to kind of get that practical experience when it's just 1 to 2 years, and then following that you do an internship here. So I think my journey kind of was a bit of coincidence and luck how I ended up in sports science, and I kind of just wanted to explore kind of that inherent nature to want to help people and do it through movement. I think towards the later stages of my undergrad degree, it got to a point where I was playing for Maltese water polo, obviously, and I got badly injured. And then when something that sparked my interest, and I was kind of set on biokinetics from that point onwards, was when I got injured. I went to see a biokineticist myself. Shout out to Ian Rainsford, who was one of my greatest mentors at Stellenbosch. So he managed to treat me, and I think I came in with chronic low back pain, and within 2 or 3 weeks I left. And after doing that rehabilitation and going through the process, I was obviously in awe of the power of how within that year my pain never came back. So yeah, it was a very kind of pinnacle point and moment where I was like, I've so happened to study sports science, but I've also had this amazing experience with biokinetics, and I wanted to know more about it. And I said, cool, let's travel along this journey and just keep it going. So yeah, that's kind of how it all started.
So it was kind of it was a personal experience married with your wanting to help people, and then having that curiosity around,
Exactly.
wow, this is an incredible thing. How can I kind of unpack it more and
Exactly. Yeah.
hopefully share that with other people?
Yes. 100%.
And out of interest, what were some of the interventions that your mentor used to help alleviate some of the low back pain you were experiencing?
100%. So what's amazing is that, and obviously we can go into it in different podcasts and different, I think we're going to need a lot more than one to tackle every sort of in-depth detail of how we treat injuries. But some of the interventions that they use, and that's what they kind of walked through with us and taught us, is kind of, it's at different levels. So and that's why I want to explain today, kind of to the audience and to you guys. I think a lot of people come to me and ask me, what is biokinetics? And often when I speak to people on the streets and they ask me, or my friends, they're like, are you studying like biochemistry or something? And you're like, no, it's not that. But so it is quite a confusing term, and not everyone knows exactly what it is. So in terms of just explaining to the audience what biokinetics really is, I can obviously explain to what it entails, the detail, but more importantly, as we'll go into now, is like knowing when to reach out to a bio, knowing at what point in my timeline of my pain or my injury am I going to go see that person. So yeah, in fundamental terms, biokinetics, bio comes from the Greek word mean bios, which is life. So that's kind of the term there, and then kinetics means kinesis being movement, and kinesiology, the study of movement. So I'm not going to bore you with the history about biokinetics, but kind of back when biokinetics was still an up-and-coming sort of interest of studies, it was called kinesiology, and that kind of was the study of human movement and how that plays a role in kind of advancing human physiology, and the role that exercise plays in that. So yeah, it's amazing how much it's progressed. Eventually, kind of it went from being this thing of rehabilitation actually with kind of people that had got injured in wars and wanted rehabilitation, and that led to an interest in the universities. Eventually they named it biokinetics. So yeah, that's just a bit of background about how it was kind of first started, and biokinetics being life through movement. So it's all about movement as medicine. Quality of life is obviously increased through movement therapy. Um, and then, like I said, I think what's important to dive into today, and that's what we'll chat about, is like kind of it's more important to ask yourself, when am I going to go see this person? It's obviously integral part to know why and who this person is and what they do, but also knowing when to see someone is important, because that'll help you in your timeline, especially. Yeah.
I think that's a great segue into. Personally, I find the history of things very interesting, and I would have loved for you to
I
just
know,
go down
I
that
go
rabbit
into
hole.
that rabbit
But-
hole.
Likewise.
But I'll leave that because we can chat about it afterwards. But you've kind of moved us into a nice direction around what the rehabilitation process looks like from a high level. Obviously, it varies from case to case, but where in that kind of system or process would a bio come in?
100%.
Where would you come in? And you know how for instance does, I mean, we've had Tristan Kukumur on here, the Cape Town Cairo,
Oh, excellent. Nice.
and he's very knowledgeable and also super passionate like you.
Yeah.
And we've had him share kind of the difference between bio, chiro, physio. But if you could kind of speak to that as well,
Elaborate,
what
yeah.
is the difference there, and where in the rehabilitation process would a bio usually fit in?
Great question. I think, like we mentioned, it's so important to know where on that timeline do I sit. And I think to explain fundamentally is, yeah, it's a hard question to answer, because biokinetics, it involves so much. It's very complex, and it involves a very wide range of treatments. Simply, bios are exercise therapists. We treat orthopedic injuries, so that means injuries of the musculoskeletal system. So bones, ligaments, tendons, muscles. Furthermore, we also treat the chronic side of illnesses, disease, and pain. So if you think about, people with diabetes and weight management, and that's a whole nother side of biokinetics. And then there's also a neurological side. So neuro rehab is also a massive. So in terms of the timeline, so a simple question to ask yourself is kind of, not only kind of, I think using pain as an outcome measure is great, as a parameter to kind of know when and who to see. So to explain what I mean is, so let's say, I'll use a runner for an example. So let's say you go for a run on the prom, you have a little bit of an ache in your ankle or your knee, and you wake up with, let's say, a 7 out of 10 pain. So usually bios only treat between 1 and 4 out of 10 in terms of the pain scale. So
We're saying 1
Yeah.
is pain-free or
Yes.
very little pain, and
100%
10 is unbearable.
is unbearable.
It's excruciatingly
Exactly.
painful.
Yeah.
Okay.
So that's exactly a great distinction. So if you above a 4 out of 10 pain, so you're waking up and it's a lot of pain, usually that will indicate to you, okay, I need to go get some acute treatments. Acute being in the early phases of your kind of rehab journey, and usually that's a physiotherapist. So that's where they'll step in. I work closely with physios; they are incredible people. So just to premise the conversation on that, is physios are great, and everyone plays their own role. So physios are to distinguish between the two, are acute, are very acute based therapy. So it's very short term, and it focuses on a lot of manual therapy. So with regards to manipulation and massage and using different kind of technologies to help reduce your pain. Then following that, I think it's important that if your injury starts persisting long term, that's another parameter you can use to say, okay, maybe I should go look to see a biokineticist who's now going to look at more in depth and in detail of your biomechanics, your movement, analyzing your movement, your nervous system, and kind of what's going to happen long term to prevent that injury from coming back. So for those of you that are listening that kind of have that ongoing persistent pain or injury, physios are amazing at treating that acutely. And then, like we're going to speak about, if you're a great therapist, you have a great referral system as well. So being able to know, okay, my job here is kind of done. Well, not completely done, but there's a kind of interlapping of these timelines. I can refer this guy to the bio now, who's going to look at more of what is the cause of this injury in the first place. So I like to say this point, which is so crucial, is biokinetics, we love to treat the system and not just the symptoms. So that's a great thing. Treating the system and not just the symptom. So the symptom is obviously the pain, and obviously you want to reduce that pain, otherwise you can't train. So we work very much so on the system as a whole, looking at the body from different angles, different lenses, to create an holistic exercise kind of intervention to push you into your long-term goals. So, yeah,
A lot of it can stem from mechanical issues. So like,
100%.
so
Yeah.
in a way, the physio will help deal with that acute injury,
Yes.
reduce the pain, and then it would be your job to work on the mechanics around
Yes.
why that injury keeps reoccurring.
Exactly.
Yeah,
100%. So
that's
yeah,
great.
so there's definitely a distinction. So like I said, I think focus on pain as a parameter. So if your pain's below a 4 out of 10, it's a long-term persistent pain, I think it's great to contact a biokineticist, because they're going to look at all those systems. If you want short-term acute treatment and your pain's really unbearable, of course, go see a physiotherapist. They are at amazing diagnostic. They have amazing diagnostic abilities. So they're tools to differentially diagnose between a peroneal tendinopathy or a muscular strain are amazing. And that's where you can get a little bit more clarity to what this is, and then looking long term, working with the physio and the bio collaboratively. So that's something that I really am passionate about, is collaboration. It's not like I'm going to go see physio, then I'm going to go see bio, and I'll see chiro separately. It should be this collaborative effort for all the therapists involved to know, okay, this is where this person's at in his timeline, and then from there you can go forward. Yeah.
That's awesome, and
Yeah.
the way that you articulated that was super clear and helpful.
Thanks,
And it's quite interesting because reflecting on my own sporting journey, in the Marty's rugby
Yes.
setup, I remember in season I'd see the physio, and during the off season I'd go to a bio,
100%.
and it makes total sense now. To be honest, I didn't really
Yeah.
ask into why that was, but I
Exactly.
remember when I was in season and they just wanted me to be kind of comfortable enough to play, I would just go to the physio,
Yes.
get some manual treatment, like to get a bit of a
100%, yeah.
relief, like, okay, go
Pain
play,
relief, go play, yeah.
like, strap and play, get on
Exactly.
the field. But then when we got a little bit of time and we're building into a
Yes.
fresh season, okay, we can spend some more time on
Yeah.
actually getting to the bottom of what the
Yes.
cause of this issue is.
100%.
And that can obviously, span into kind of day-to-day life, not in a sporting context,
Of
but just a
course.
general human movement
Exactly.
context. Something that's really interesting that you brought up is talking about how bios treat diabetes. I know this isn't something we chatted about
Yeah.
beforehand, but I'd be interested to hear what some of the interventions around that
Definitely.
might be,
100%,
and
yeah.
how much, is that kind of an area that you enjoy? What comes with that? What are some of the kind of challenges you found?
100%.
What does that look like? Because that's an
it's
interesting
challenging.
one.
Yeah, so I would, to just comment on that, it's a great question. I think the neuro and chronic side of biokinetics is very much something that you have to be passionate about. I think for me personally, I'm extremely passionate about the orthopedic side. Obviously, being involved in a sporting environment, you kind of get used to treating orthopedic injuries. So that's obviously, again, of the musculoskeletal system. When it comes to a chronic disease like someone who's a diabetic, then your systems and your approach change a lot. Not massively, but in terms of balancing cardiovascular training and strength training, you kind of your monitoring and your management of this client is imperative. So I think on the ortho side, there's obviously I think there's a little bit more freedom where you can utilize different training methods. I think with people that have chronic diseases, you've got to be very much. So this is something I would also love to chat about is evidence-based practice. So what I mean by that is using research and evidence in this realm of rehab, and using that to aid or facilitate your interventions. And it's important to know your monitoring of a diabetic patient, taking their bloods before the session, because that's obviously a diabetic. I'm not going to go into the physiology about it, but in terms of their insulin sensitivity and the levels of glucose in the blood itself, you need to monitor that, because that's going to change. When do they inject themselves? And you've got to know these things. So it's important to know your history of your client really well. and how you manage this person is difficult because some days they're going to have, let's say they forgot to inject themselves with their insulin, and now all of a sudden there's the consequences are more severe, kind of collapsing or fainting in your session. So you really have to monitor their blood pressure, their heart rate, and you have to kind of use these a few outcome measures that you can measure, that we'll measure, and then utilize those. In terms of the training itself, there's obviously clients that are kind of are managing their diabetes well, so you can kind of do what you must, so cardiovascular training, kind of low level zone 2 cardio training, and then strength training is obviously super important to improve insulin sensitivity as well. I think exercise as a whole is that the process becomes simpler in terms of the program, but the management of the client is a lot higher. So that's kind of the balance, yeah.
Do you ever have to deal with multiple risk factor clients? So like someone that
100%.
has diabetes and then has an injury. So then it becomes
Exactly.
like the list becomes longer.
Yes.
The management becomes harder. So you have
100%.
chronic illness as well as an acute injury, and then perhaps another risk factor as well. Maybe age as well.
Yes,
Age
of
another,
course.
like
That's
older
a
than
comorbidity,
65. Yeah. So you have like three risk factors you have to deal with, and that can become super challenging. Right?
So challenging, exactly. So obviously you guys know as well, when you're dealing with a client in terms of the training itself, you've got to make sure you know their comorbidities, their risk factors, and then once you figure out those risk factors, you can kind of put them into a high risk, low risk, medium risk. And then from there, your training is definitely going to change, and your management of that client will change. I think in general, why exercise is always promoted so well is because it's generally safe. If you know what exercise to prescribe, it's generally safe, and you can really create an incredible physiological and long-term change within those high-risk clients. But again, it is a very much kind of balancing act. And yeah, you really have to treat the client with a lot of kind of safety in mind as well. And I'm not sure how you guys balance it here, but I'm sure people come in and they have like high risk kind of factors on the side or comorbidities, and you really have to like sit down and consider other things. Now you can't just be like, cool, let's just do this program.
But that falls into what we
yeah.
spoke about over coffee, where you've
Yeah.
got to, as part of being a coach or being somebody who just helps people with lifestyle and movement, is you should have, and if you don't, you should work at building a network around what your scope is and where you can slot in and how best you can serve people. We've kind of got a little ecosystem here in which there are people that have scope for certain things, and others don't have scope for a bunch of other things. Like I said to you, I kind of view my scope as helping people change their relationship with exercise.
Love that.
Anything that falls outside of that, I would generally suggest or kind of refer on to Gideon, or even outside of the gym to someone like you or Jade or Tristan, where there must be this understanding of like what you can actually do and how you can collaborate with other professionals to help that client as best as possible.
Exactly. Yeah.
And it's so important to have that kind of humility to be like,
Yeah,
you know what,
true, eh?
this is a client who I'd love to work with, but at the same time they come first, so we've kind of got to
Yes.
point them in the right direction in terms of who to
course,
see and
yeah.
who to work with, which I think is it's an integral part of
So integral.
of what we do.
Yes.
What is your favorite client to work with? Have you found that yet? Because I know it's taken me, I told you, it's taken me about 4 years to figure out, okay, that's my scope, that's what I like.
100%.
And I'm sure, Gideon, it's taken you some time as well to be like, I
Definitely.
really like
Yeah.
clients that have a number of
Still
comorbidities
learning.
and trying to do this. And
Still learning. Yeah.
and it does kind of, it adapts over time. It's like a relationship. The thing will shift and grow with kind of where your interests are and the stage of life you're in and where your skill set shifts.
Of course. Yeah.
But currently, right now, what kind of client profile makes your eyes kind of, light up? What kind of like gets you going in
Sure, that's a
client?
great question, Seb. Yeah, I think.
There can be more than one, by the
No,
way.
of course, yeah. I think what's really great is you find your niche along that journey, like you both said. I think right now, like I said, I'm really into my orthopedic side of treatment. So I'm actually trying to follow the trends, and then the trends follow the therapist, to be honest, as well. So in terms of like runners and you know, the hobbies that people engage in, running, triathlons, paddle.
Five.
Yeah,
Spoke
it's
about that
yeah.
on
We spoke
Friday.
about paddle. Yeah.
Yeah.
So I'm very much interested in the shoulder joint and the shoulder girdle as a whole. I think so. I actually did my thesis on anterior shoulder dislocations, and that's something I was very very passionate about at varsity. I think that's still there because of the water polo side of things. It's a lot of shoulders and a lot of hips. So that was always my passion: shoulders and hips. Um, and the research that I love to go into behind that is great as well. At the moment, my interests are very much in ankles and feet and knees. I think that's just because the client profile is that at the moment. So I'm very much enjoying that because it's not something I focused on originally, and I was like, oh, it's just feet, you know. And
Just
it's
feet.
just feet, you know. But the feet are so fascinating, and
Base.
it's the base of everything exactly. So um, yeah, like we were chatting before, the different profiles of people's feet and how they look. It's amazing how a slight change of your foot or a slight disconnect can affect the whole chain of your whole body. So that's something that I'm really like interested in at the moment. So I've got a lot of guys coming in with ankle issues and knee issues, and yeah, it's exciting. It's exciting rehab to be involved in. Yeah,
Didn't you say that you have a relationship with Willem van der Merwe?
yeah.
So he will obviously be sending you a lot of knee guys,
Definitely,
knee
yeah.
people.
So
And
obviously,
sports related,
yes,
probably.
exactly,
Yeah.
yeah. So in terms of the sports related ortho medical guys, they're incredible. What they do in terms of like the titanium implants and kind of the reconstruction of the knees and ACLs. So yeah, that's also something that I'm really passionate about is kind of post ACL or meniscal surgeries, and then getting involved in that whole rehabilitation process. Why I love it so much is because you can really form an amazing relationship with the client because that timeline's obviously very long. So, like for example, an ACL post surgery, you're looking at 9 to 12 months with your client potentially, if they're gonna fulfill that whole journey with you. I think nowadays with the technology of like Willem and how he created the Grew Cox bike and
Did he create that?
yeah, the
That's
technology is
wild.
incredible. Yeah, so
Sorry to interrupt you, but
no,
is
no.
the Grucox bike different from that like
Yes, yeah, the
machine thing that
Biodex,
also
yeah.
like fights
Exactly.
your with the
So
eccentric loading?
I'm not sure if the bike has isokinetic properties, but I know it's focused on eccentric training. So it's incredible tech, and I would love to obviously familiarize with myself with that technology. The Biodex is incredible. Obviously, you probably got yourself on one of those in
Is
Stellenbosch.
that the leg extension thing?
100%, yeah. So a Biodex is basically like an isokinetic testing device, and it's very very cool. Yeah,
So cool.
you would love to spend some time on
It's
that.
so
Yeah.
cool.
Yeah, so you can use it for almost any joint in the body, which is cool. So a lot of the time it's used for knees because it's just simple to set up. But in the practice at Stellenbosch, which was an incredible space to be in, we were using it on shoulder guys, kind of hip guys, anything. So
Like internal, external rotation.
yeah, exactly for like serratus anterior work and yeah, it's awesome. So those
For the gym.
yeah, investment.
What makes that device so effective?
So
And why that as opposed to bands or
yes,
weights
exactly.
or anything else?
Okay, so why it's very very you can dive into a rabbit hole with those types of things, but why it's so amazing is because not only can you have so they're called outcome measures. They're basically measures that there's tangible things you can see and measure that will give you a indication of whether that client can progress to the next phase of rehab. So it's very important to know that rehabilitation is not just timeline based. So it's not just, okay, if I spend 4 months with this client, he should be good. It's outcome measure based and evidence based, practice based. So what that means is that if we can say, okay, his quad to hamstring ratio is this percentage to this percentage, then he can progress to the next stage. And that's why those machines, I think, are so incredible because they can show you that data on the screen. So it's connected to like an application, and it'll show you with the testing, and that testing can give you an indication. Cool, my program is working, and that's awesome because if you think about, like, if you just have a space with bands and stuff, it's amazing, but you can't really tell if the person is progressing without the data. You can take a calculated guess, but in the world of biokinetics, you're not supposed to be guessing. That's why I say it's research-based practice, because you're using what the research suggests, and you're saying, cool, this person's got this ratio of hamstring to quad. He's passed this, and this test. His quad strength is X amount of newtons. His peak force to this ratio. So it gets complicated, and I can actually get a whole sheet in, and we can explain it and go through it. But that's kind of the basics. And then another amazing thing, it's really safe. So the machine doesn't allow you to go past certain ranges when you set, and you obviously felt that. It'll stop you at certain ranges, and then again, you can use the program to create a lot of eccentric strength. The physiology behind eccentric training is incredible. Obviously, we use it in our practice all the time. And yeah, so that's kind of why I think it's incredible stuff. Yeah.
And I think that also a cool thing is that if you have a set program of 3 months, you can cut it almost in half by using the equipment, and it'll allow you you basically reduce it. You might think to yourself, I need to have 3 months with this client, but they actually blow you out the water with the program. Like, they really adapt well to it, and it allows them to heal quicker.
Exactly. 100%. So yeah, it'll cut that timeline. It can cut that timeline really short, a lot shorter, And nowadays, people are seeing those timelines shorter. You can see examples of Sia Khaleesi's of the world and Peter Steph-Totoy post their knee ops. Their recovery is incredible. Like, to have a 3 to 6 month post ACL recovery time is like mind blowing to me. And I'm like, oh, this is not taught in the textbooks, So there's technology out there that's creating incredible things, and that's something we can also discuss, the Grucox bike and the Compex machines and all of sorts of that work.
I'll definitely take us down the complex route
Yeah,
shortly.
the Compex, yeah.
But I wanted to go back to something that you mentioned, which was essentially having objective data to work with.
100%.
Measures and feedback that you can work with in the rehabilitation process.
Yes.
I wanted to take it down a slightly different route and ask you what you feel the role of and how important is subjective feedback in the rehab process. It's amazing to have these tools that can measure objectively the exact data points, but how do we kind of factor in the individual, and maybe if there's a sort of divergence from what you're seeing from a reading versus what your patient is telling you?
Incredible question. I think yeah. So that's something that we can go into, and from my side, you really do see it. You really see. Often there's a difference between. So we use questionnaires. So subjective questionnaires are an incredible thing with the athletes as well. So, for example, there's a questionnaire we use with the ACL guys, the psychological readiness to perform and to get back to on the field. And often the data is showing one thing, and then his psychological readiness questionnaire is saying no, like he's not ready. So, like we will discuss, the psychological aspect to your client and that reflects from your training. So if you haven't put the client into effective positions where he's going to gain that confidence back and really feel ready to perform, he might be physically strong enough to, but you know what I mean, there's going to be things that reveal. So I think the subjective side is really, you shouldn't overlook it. It's incredible to address that side and make sure, if you're a therapist as well, obviously check in with your clients regularly. Make sure you're doing those questionnaires. You checking kind of where they're at, because it very much so healing is a psychological journey, and a lot of people can't get back to that spot where they were because of confidence, because they feel, oh, the side's like the weaker side, So I think that's an incredible question, and I want to ask you too as well, kind of how do you work here with clients in terms of their subjective kind of side, and how do you deal with that? Because it's hard and I'm dealing with this at the moment, just having a small space with not a lot of technology. What do you do, Yeah.
Gideon, I think that's a good one for you to jump in.
Yeah, I mean, for me, I use a lot of subjective feedback. I use questionnaires as well, like when cycling through programs, I send a client a questionnaire just to get feedback on the previous program, like working towards a set goal.
100%.
I have a plan in mind, but they might not like the particular exercises on the upper body day, didn't suit them well. But in my mind, like that's the best way I can get them to their goal.
100%.
But they didn't really enjoy it, so I need to then adapt it, as well as like subjective feedback in session. Like if they're struggling with range of motion, like we kind of like take a minute to like discuss what's happening, and then we give an alternative exercise, or we just kind of change it in the session, as well as along with like manual testing and stuff. But a large portion is down to subjective feedback, and it's also like being in tune with when to ask for the feedback. Like I get a lot of clients that will be largely silent through the session, and I don't know if you ever find like when you're asking a client to do a particular exercise and where they should feel it, like you ask them before you tell them you should be feeling in your quad. You're like, okay, where are you feeling this before you tell them?
Feel it in my neck.
Yeah, and then it's like, okay, we need to change it. So it's a lot of teaching them to understand where you need to be feeling this.
100%.
Like if we're targeting the glutes, but I'm feeling it all in the hip flexors.
Of course.
So what's happening?
Exactly. I
So
love that.
A lot of in tune teaching from their side. So then like 4 weeks down the line, they're like, okay, like I'm really feeling this in my glutes. This is what I'm supposed to do. So a lot of that.
Exactly. And I think just to mention something that you said, that sums up the middle of what you said was the adaptability of it. You really got to be adaptable in your sessions, and like you said, being able to connect with your client on a level that's not just data and science based, and can really connect with them and make sure you're adaptable. You're asking them questions, and you're asking them, okay, what's your like RPE or your pain or your how can we make this exercise better for you? Exactly.
Like I have a template for most clients, and then I slot them in wherever I think. And then sometimes like they blow me out out of the water. Like I set them at like all the way at the beginning, but they're like 7 weeks ahead from where I planned them to start. So just kind of can really just place them. It's all about subjective feedback.
Exactly.
That's basically how I deal with my
That's
clients.
awesome. Sure.
I think that's a really cool question, and there are different ways to apply it. For me personally, I think the biggest element of subjective feedback is teaching the client or teaching the patient how to communicate, how to understand where they are, because we take for granted that we've all played sport here, so we can communicate how we're feeling physically, and that's something that isn't actually just common sense. Somebody will be like, "What is a 7? What is this?" If they've never felt an 8. They're going to place things, and that's going to affect how you then receive that. So for me, a big part of it is, especially because it's about, in my scope, teaching people about how to kind of relate to exercise differently. It's just taking them along that path of learning about what it means to push yourself, what it means when something is a little bit harder than it should be, when we need to dial it back, when we can dig a little bit and push a little bit harder. So for me, it would definitely be more, I use it a lot actually in my programming. Like I'll hardly ever actually program a weight or a pace. I'll do RPE, and you'll know Gideon's actually one of my running clients. Awesome. And if you have a look at his stuff, it's like mainly RPE based.
Great.
So it'll be, but you're very easy to work with because you know what that means. You know
what RPE means and where to put it on the scale. Like you said, it's tough for clients to know, okay, how are you feeling? And then it's like, well, I'm not really sure actually, like I don't know what scale this is, or so like you said, it's important to I think this is hard, so I think that's great.
I remember yesterday, actually, perfect example. I'd done my programming for my online clients for the week. I posted on my group, remember to do your check-ins and send me any questions. As I'd finished this person's programming, she sent me a message saying, what is RPE 3 to 5 on the treadmill versus on the road? And initially I was like, it's the same thing, but then I was like, wait, this is this I need to impart some sort of explanation around it, and it's like, it's not just like a given that is readily understandable information. It's something that you need to take your client or your patient down the path of, this is what kind of perceived effort is, and it can be different today than tomorrow. And if you're looking at a watch or something that's telling you your time, that can be different, but your rate of perceived effort or exertion can be different. And trying to get that message to kind of sink in is also, it can be challenging initially. And I think it's very important to do that bit of teaching when it comes to the whole subjective feedback thing, because it is subjective.
Like the psychosocial factors around this client, and they come in and they're tired, they haven't slept, they're busy at work, so their RPE is going to be completely different on the scale. I love that, Joe. And I think as well is that something that biokinetics focuses on so much, is re-educating the person on how to move. You know, it's not just you come in and you listen to us and then you kind of move forward. It's, you know, we're teaching you about the body systems and the muscular tissue, and like you said, this is your glute, this is how it works. You know, otherwise they'll never really understand what's going on, and they never understand their bodies. As soon as you re-educate yourself on your body, that's when you start to manage yourself better. You know who, when, and who to see, because you know what's going on in the body, and yeah, you just become a healthier and better person in terms of your long-term physiological and physical health.
Sorry, Seb.
No, go for it.
My favorite thing with clients that become more long term is they start asking you questions about
Yes.
certain anatomy or physiology they wouldn't necessarily have asked before, and
Shows that they're learning and you're
that's
doing a great
amazing.
job.
That's like, 'cause
Incredible,
at the end
man.
of the day, we're teachers. We want to teach
teachers,
these
yeah.
clients as much as we know and give them as much value as possible.
100%.
And when they start like asking us, I was like, okay, this is really cool, because now they're grasping what we're trying to teach them, and now they're sending it back our way, which is great.
Exactly.
And there's just more continuous learning, which is awesome.
Awesome, I love that.
Yeah.
Yeah.
On that as well, I remember, I like to tell this story. One of our clients from Uruguay, and I'm so sorry if this is wrong, but they speak Spanish in Uruguay, I'm pretty sure. And he told me that a coach or a sports coach or a gym trainer in Spanish is profesor de gimnasia, as in you're a professor or a teacher
Professor.
of gymnastics or of the gym, which
Wow.
is exactly what you're saying. Is, you know, it's like you, at the end of the day, you're trying to teach people, whether, you know, you're teaching people movement, you're teaching them how to
That's
kind
great,
of
sure.
use their bodies in different ways.
I love
which-
that.
yeah, which is awesome.
Professor.
And speaking of teaching, I'd love for you to teach us a little bit about what excites you so much about a Compex. We're talking about, you know, these awesome tools that we have that can be used in a rehab process. I've had the Compex kind of machine.
Have you used it?
I've used it before, yeah, when I played rugby. I think I had it on my
quad.
my quad, because I had some
BMI.
knee issues playing rugby.
How did you find it? What was your experience with it?
It felt nice, but to be honest, I was very much like,
Skeptical.
I wasn't skeptical. I just kind of was like, if this is going to work to get me to move and play properly, then I'm happy. I didn't really understand what the benefit of it was.
Yes.
And I think it would be, sometimes it could be quite sore, but it also at times felt like a little bit of a massage, which was quite nice.
Exactly.
But it was doing the kind of pulsing.
Pulsing, yeah.
But what is it? What is
Yeah,
that technology,
100%.
and how does it fit into a kind of rehabilitation?
For sure. Great question.
Process.
I think what's great as well is professionals having different toolkits, you know, to treat. And I think where the Compex comes in, which is great, is that it does provide a way to kind of come to you in a different timeline. Like we spoke about, the timeline is coming to a bio only for kind of late to final phase rehab. The Compex allows me to treat individuals in their early phases as well. So that's where the technology is great, because it has certain settings where it can treat pain. So basically, to the audience, to describe what it is, it's a muscle stimulation machine. It's called EMS, electrical neuromuscle stimulator. So what it does, it basically sits on the tissue, and at a subcutaneous level, it tells the tissue to contract. At obviously the whole premise of how we move is based on the nervous system. So the neurological and nervous system is sending impulses via obviously acetylcholine. Is like that messenger that's traveling from the brain to the tissue, saying, okay, you must contract. What the machine does, it basically acts as that messenger system. So it kind of bypasses the brain and activates that tissue at a level of reducing pain, increasing capillarization, which is blood flow to the area. So that means recovery and healing, obviously. And then at another level, it's muscle atrophy. So conditioning, like you probably tried the muscle atrophy setting, but it really, really activates the muscle tissue. So it feels like you've squatted 300 kilograms, but you haven't, you hadn't had to do that technical movement to get the same activation that the complex can achieve. So like you said, in terms of accelerating your rehabilitation, getting rid of your pain, there's so much that it can offer, which is great. Yeah.
I just wanted to ask a question
Yeah.
about what do you think like like for example, like on the quad, like that's maximal stimulation versus like a full range of motion squat, like muscle
Yes.
activation, muscle recruitment
Yeah,
versus the
100%.
stimulation. What is the difference, maybe for the
course.
audience to understand, like
Of course, yeah.
the difference
So-
between the two?
So in terms of like muscle recruitment, obviously, I wish there was a way that you could actually measure. So we could take someone through a squat and take someone with the complex and say, this is the motor units you're recruiting, and here's the par or the level. I don't think there is that at the moment. So that's actually, you just sparked my interest in creating something like that to measure kind of or compare the two. Where I think the complex is so great is that it can recruit maximally like an incredible amount of motor neurons and motor units that will create incredible changes in the tissue. But I think at this stage, I'm not sure, like you said, how it translates to, or how it kind of compares to like a deep squat or like a knees over toes squat in terms of activation versus the machine
It doesn't
itself.
really tackle range of motion. It like it
100%.
stimulates.
It doesn't
but like
tackle
a full depth squat.
Exactly.
Is maximal contraction, maximal
100%.
lengthening. So I'm very interested in the difference between the two.
Yes.
And the change which can come from either.
Of course, I love that.
Yeah.
And I think so. How the program works is initially you start out by putting the machine on, and you choose your setting depending on what the client comes in with. So let's say you've got mal tracking of the patella, and you want some VMO work. Okay, so we put that machine on you, and initially we don't do any movements. So we let the machine do the work for the first 3 to 5 sessions, and it really activates the tissue and gets you aware of it. Following that, then you can introduce movements with the machine on, which that then obviously now is like 2 in 1. So you get a really nice activation if someone kind of doesn't know how to connect there, and a really great recruitment of that tissue while you're doing an exercise. So now you're lengthening and contracting. So then I feel like the benefits start becoming like this compound effect,
So I just want to jump in.
Yeah.
I know you've got a client. You must hop when you want to go. Gideon.
I'm just enjoying this so much.
Okay.
But I'll go in like 30 seconds.
So my question is, what evidence is there? Have there been studies conducted where they take a control group who don't use the complex and are rehabbing a certain injury of the same kind of population, demographic, training history, all that kind of stuff,
100%.
and then conducted the same rehab protocol with the complex, and then there be a comparison in terms of return to life?
Yes.
And what did
love
that look
that.
like? Does that research exist, and what is it telling us?
So interestingly enough, I've only just actually bought this machine, so I'm still actually looking into that research. But that's why I'm so fascinated about it, because I really want to know kind of what the studies are, what are the controlled studies, and what do they show. I think for me, for now, where I'm using it is kind of at a level of pain management and a little bit of conditioning at the moment. But I'm sure there are studies out there. But I think complex is definitely unique to South Africa in terms of the technology that they've actually patented and they've used. Because we can go into all the tech, and I think it has like this MyScan technology, which is like muscle intelligence scanning. So what it does, it scans the tissue, and while it's activating it, and it will reduce it or increase it depending on like the tonicity of the tissue, and it basically kind of is like a self-functioning machine, which is incredible tech. Usually, like if you buy like a TENS machine, like one of those transcutaneous electrical stim machines from like Take-A-Lot, you can put it on the tissue, but it's not going to scan or do any of that sort of intellectual programming. It's just going to like pulsate. And then you have to adjust the pulsation. So where this is so great is that you kind of can put the machine on a different setting, and it'll just be so specific to the tissue, and it'll change relative to Seb, relative to me, or relative to you, depending on the site as well. So
And I
that's
think,
pretty cool.
yeah, I think the
Yeah.
really cool thing that I've read as well is that the introduction with that and a movement and exercise, because then it can learn where muscles aren't activating where they
Yes.
should be, and it
course.
stimulates the desired area
Incredible.
where that muscle needs to be working, and then
Exactly.
that I think like for end stage, like coming back into a sporting environment, fixing mechanic that maybe was
Yes.
lacking prior, for reintegration back in sport,
Love
and then
that.
injury prevention going forward.
Of course.
That's
yeah.
stuff that I've read.
I love that, and I think there are limitations within movements, because, like for you guys, how long do you spend with a client often, and you're doing a movement, like let's say you're doing a TKE or a split squat, and you're trying to get this one muscle activated, and they just can't. So putting the machine on there is saying, hey, like I'm here, like wake
Let's
up.
do it. Yeah.
You know, so it just accelerates that, like you said, the nervous system's response and that awareness, because at a fundamental level, it's creating this awareness within the tissue and your nervous system to start actually activating. So, you know, like for you, like putting it on for initial sessions and then utilizing it during like a squatting movement, it just makes the process so much quicker. You know, and like anything nowadays, everyone and athletes want things like this. You know, it's like that instant gratification. They want to come to you, and the next day they want to be like fixed. All their problems and pain must go away. So, obviously that's not the case. But those kinds of technologies are a nice aid to your normal kind of training.
Gideon, do you have any more questions?
I have many more questions, but I have to jump off. But I know that we will have
We'll have a
future
series,
episodes.
yeah.
But so interesting. So many different
so many
topics.
things to
I love
dive
it.
into.
I love it. I love it.
So Gideon's just left us, and I know he's going to
Yeah.
miss this question, but
Yes, you know.
he can listen to us afterwards. You, from what I've observed in your content, love using bands. It's a tool. It's an implement that is, it's in your arsenal. It's ready to go. You've worked with one of the members here, actually, Guma. I saw him doing bands the other day. Yes.
Legend.
What is what's the appeal for you around bands? Why do you implement them? And yeah, what kind of led you down that rabbit hole?
100%, yeah. No, it's a great question. I think so to be honest, actually, I'm moving away from bands, obviously. So in terms of bands weights, it's all just a means to an end, and an outcome. But I think where I utilize bands a lot at the moment in my practice is I've moved away from using them as a form of kind of force and kind of progressive overload, and more as like a cueing mechanism.
Okay, to kind of switch things on.
100%, and also cue biomechanics and cue alignment, and like we spoke about, like a lot of it is nervous system driven. So teaching the nervous system, okay, this is a good position, this is incorrect in terms of certain misalignments and imbalances. So in terms of like early phase rehab, your phase 1, phase 2s, I think there's a big stigma against using bands. So a lot of professionals don't like using bands because they think, oh, well, it's just this, it's so light that it's like, it's not going to really do much, and there's no chance to progress. However, I think in your early movements and early phases of rehab, I love to utilize them because it teaches the client how to have some sort of resistance in a movement without overloading the system too much, which is great. And like I spoke about the cueing, so I use bands a lot in different positions, So something that I work with a lot is, for example, runners who have like misalignment or patellar maltracking, and the hip, knee, and ankle alignment is just off. So you can utilize bands for the therapists out there. People obviously are utilizing them a lot to reposition joints in space to make them more aware and kind of solidify positions. Because a lot of people, like we spoke about, don't have that awareness to say, okay, my knee's here, my ankle's there, so like things are a bit funky. So kind of getting people into the right positions, I think bands are amazing because you can kind of, like, they're very flexible, and you can put them anywhere and kind of teach the person, okay, like align yourself against this band, and then they can move from there. Um, Again, certain movements, I think bands are amazing because like some of the stuff that I was doing with Lisa, we're doing like a movement that it'll be quite difficult to add weight or progress it, and that's why bands can come in handy. You can chuck it on the distal part of a limb and let them move in a way that and add a little bit of load. So that's great. Yeah.
It is a cool
Yeah, it's
implement. I
cool.
think what's nice about it as well, for me, in very simple terms, is you can use it to make movements more challenging and more difficult. So loading
Yes.
it up, and you can also use it to make movements easier. So you can
100%.
scale things back. For
Yes,
instance,
exactly.
a pull-up.
Regression.
It's a fantastic tool to
Wow.
get people to learn how to do a pull-up. Um,
Such a great example.
it's
Yo.
and I mean, Mark, we like to use the bands on the pull-ups there. And most of my clients actually who are trying to build their pull-up capacity, I love
Yes.
using
That,
bands.
bro.
And then in my own kind of
Yeah.
context, if I'm trying to improve like ballistic kind of force production,
Yes.
I will use it to kind of make the
100%.
lift harder towards the top. Whether that
Exactly.
is an assist